So going over the movements of the back muscles, we've already identified all the back muscles. Now we want to go back and try to figure out, by looking at the muscles, how we can figure out what their function is going to be. So if we start with the two superficial muscles, first thing you want to look at is to see the bundles of muscle fibers. And if we're looking at something like latissimus, we can see on both sides. We can see all of the lines in the muscles look like stripes. Those are actually bundles of muscle fibers that we're seeing. And we can see that latissimus fans out in this direction here. So all the fibers are going kind of in this way. So we can take the average of them and say that the line of action for latissimus is going to go in this direction here. Over on this side, it would go in that direction there. Because in general, these fibers are all parallel to each other. They're all going in the same direction. Now, contrast that with something like trapezius, and we can see that the fibers of trapezius are going in different directions. So they end up going in different directions here. So the lower fibers are going this way, the middle fibers are going this way, and the upper fibers are going to go this way, up towards the skull. Again, see the same thing on the other side. We got fibers going this way, and that way. So this is where we had said that trapezius has multiple functional heads because we have different lines of action, where something like latissimus only has one functional head because it only has one line of action. For the function of latissimus, that's something we'll do in a later video, so we're just going to reflect this. We're going to reflect this one out of the way, and we're going to concentrate on trapezius. So what you want to do is I'm going to move the scapula up into place a little bit here, get it back up where it should be, there. We need to decide, let's look at, say, the inferior head of trapezius with the line of action going this way. We need to decide, how is this muscle going to pull? We know that when muscles contract, they get shorter, which means that the attachment points for this inferior head, which would be along the spine of the scapula, which you can see it attached right there, and along the spinous processes of the lower thoracic or upper lumbar spine here, that we know that these points need to get closer together. So when this muscle shortens, either this has to go that way or the spine has to go this way. So we represent that by either pulling in this direction or pulling in that direction. And here you need to decide which of these spots would be more movable. And in this case, it's going to be the scapula. So the scapula is actually going to move down towards the spine in that direction. So we'd represent it again this way. I'm going to show the action of this muscle by pulling the scapula in that direction. Now, the next thing you want to decide is for the movements, if we have lines of action that are going at oblique angles, like this one is, we don't have movements to describe oblique lines of action. We only have movements to describe lines of action that occur in primary planes. So we need to take this oblique line of action and break it down into its primary components. So if I'm going to pull in this direction, part of that muscle is going to act in the vertical direction like this, and the other portion of it's going to act in the horizontal direction like that. So we're going to end up doing both of those things at the same time. So as I pull down and I pull medially, the scapula is going to move down and in and down and in and down and in, which will give us that oblique line of action. So those movements, if I pull the scapula down, that's depression of the scapula. And if I move the scapula medially by pulling this way, that's retraction of the scapula. So inferior head of trapezius is going to give us depression and retraction. If we move over to the middle head of trapezius here, those fibers are in a primary plane. So when they pull, we're going to get retraction only out of the middle head. And then the superior head here, which the fibers are going this way, they're actually going to pull in this direction. We're going to move the scapula towards the skull in that oblique direction there. So again, we need to break it into its components. Part of it is going to be pulling the scapula straight up, which would be elevation. And the other part, again, would be that horizontal component, which would be retraction again. So we can see that the different heads of trapezius are going to have some different functions. Once we decide upon those functions, now we can place this muscle into movement categories. So we have a couple of different categories. The first two are going to be agonist, antagonist. An agonist muscle is a muscle that performs the action that you want to do. So if we wanted to retract the scapula, that's what I want to do, then any part of trapezius could be an agonist muscle for that movement, because all three heads are going to, in that horizontal plane, are going to give us retraction. So again, we decide we want to do retraction. The parts of trapezius that can do retraction, which are all three parts, are going to be agonist muscles. Now, if we want to do retraction, okay, any muscle that could prevent us from doing that would be an antagonist muscle. And in this case, we need something that would do the opposite movement. So if retraction is going to pull the scapula this way, we need an antagonistic muscle would be the one that's going to pull the scapula in this direction, which would be protraction. All right, so this is retraction, that's protraction. So that muscle would be one that we had mentioned before, which would be serratus anterior. And that one's going to pull the scapula in this direction, which would be protraction. So that would be an antagonistic muscle to trapezius if we were talking about retraction and protraction. So for any of the categories, you pick a movement first. They're all movement-based. Then you decide upon the muscles that would fit that movement. So they're not muscle-based. Any muscle could fall into any one of the categories. The next category you'd have would be a synergist. And synergistic muscles are muscles that assist the agonist muscle by doing the same exact movement. So if we're looking, again, we only have one muscle here. If we're looking at trapezius, and again, the movement we're going to decide we want to do is retraction, well, then we could say that middle head of trapezius is the agonist muscle. And then we could say the inferior head and superior head are synergistic muscles. Because remember, any muscle that has functional heads we can treat as separate muscles here. And then the next category you'd have would be a stabilizer muscle. And a stabilizer is any muscle that fixates one part of the body so that another part of the body can move. So in this case, if, say, we wanted to use our upper extremity to lift something, we would need to hold the scapula in place so the scapula wouldn't move up and down or side to side. So muscles that would fixate the scapula so that your humerus can move, those would be stabilizer muscles. So in that case, something like trapezius could hold the scapula in a retracted position or a depressed or an elevated position and fixate it there so that something like our deltoid muscle could move the arm around. So in that example, trapezius would act as a stabilizer muscle because it's not directly doing the movement, but it's holding a bone in place so that another muscle can perform the movement. And then the last category we would have would be a neutralizer muscle. And neutralizers are ones that cancel out unwanted effects of the agonist muscle. So in this case, if we're looking at trapezius, if we said if all three heads of trapezius, the inferior, the middle, and the superior heads of trapezius contracted together at the same time, what movement would we get? And we'd have to add up all of the things that can happen and then see if any of them cancel each other out. Any of the ones that cancel would be neutralizing movements. So in this example, if we said that inferior head is going to pull in this direction, which is depression and retraction, and superior head is going to pull in this direction, which is elevation and retraction, we can see that the elevation and the depression are going to cancel each other out. That would be a neutralization. So when we contract all the heads of trapezius, what two movements neutralize each other? Depression, elevation. And what are we left with? The thing that is additive between those two heads, which would all be retraction. Right? So all three heads contract and we end up with retraction because the elevation and depression would neutralize each other. So we want to keep these examples in mind as we're looking at the function of the rest of the muscles on the back. So if we take trapezius and we move trapezius out of the way, here we uncover that next muscle down, which would be rhomboids. And we can see that rhomboids are mostly present in that horizontal plane. So rhomboid, major and minor, they are going to do retraction. So we would say that with regard to retraction, that rhomboid, major and minor, and trapezius, they are synergistic to each other. The other way you can tell that they would be synergistic is that their lines of action are parallel to each other. So we see the middle head of trapezius going in this direction, and we see rhomboids going in the same direction. So that would tell you that since their lines of action are parallel to each other, that they would be synergistic in their movements. So we take rhomboids, we'll just leave that in place there. And the next muscle you want to identify or look at the movement for would be that levator scapulae again. And we can see that levator scapulae is oriented mostly up and down. So this one is going to pull on the scapula in this direction, and just get back to position there. We can see that the levator scapulae is oriented in this direction. It's going to pull up on the scapula here, which is going to do elevation of the scapula. So we can see that levator scapulae and the inferior head of trapezius, that they would be antagonistic to each other, because inferior head is going to want to do depression and levator scapulae is going to want to do elevation. The next thing we can look at with levator scapulae and trapezius are the other two movements that they're capable of doing. So let's put back trapezius for a second here, and let's grab our scapula. And I'm just going to let this scapula sit on top of the body so you can see the bone, how it's oriented like that. And what we want to notice here is that while both superior head of trapezius and levator scapulae, both of them are going to do elevation of the scapula. They both want to lift the scapula, but they do it in different ways. So let's reposition this just a little bit here. And you can see that the superior head, let's see if I can get that to stay. Okay, there we go. We can see that the superior head of trapezius here, fibers here, that as they come down and attach to the scapula, that they're attaching more on the lateral side of the scapula over here. Where something like levator scapulae, we move trapezius out of the way, we put this back in place, and we can see that levator scapulae, this one, is attaching more on the medial side of the scapula. And what ends up happening here is that when these muscles elevate the scapula, they tend to only elevate the side that they're attached to. So levator scapulae pulling this way is, I'm just going to have to set that down. Levator scapulae pulling this way is going to elevate, is going to pull and just lift up on the medial side of the scapula. And we can see that the scapula is elevating, but it's also turning as it elevates. So we can see that levator scapulae pulling on that superior angle going like this is elevating and inferiorly rotating, while superior head of trapezius pulling here is elevating and superiorly rotating. So here we get a nice neutralization between these two muscles. When levator scapulae and superior head of trapezius try to elevate the scapula, the thing that cancels out is the rotations. Right? The inferior and superior rotations would neutralize each other in that example. If we take the rhomboids, let's take trapezius over here and move the rhomboids out of the way. The next muscles, again, we want to look at would be the serratus posterior, superior, and serratus posterior, inferior muscles. And the first thing we notice is that their lines of action are going in opposite directions here. So they're not parallel to each other, they're going opposite directions. That tells you that their relationship is going to be antagonistic. And here, if we have serratus posterior superior is going to pull up on the ribs, it's attached to the ribs right along here, it's going to lift the ribs, and serratus posterior inferior is going to pull down on the ribs. So this would be elevation of the rib cage and depression of the rib cage used during breathing. And this would be heavy breathing, exercise breathing. So very fast, deep breathing is where you'd use these muscles here. If we take serratus posterior superior and reflect that, again, we get back up to these splenius muscles here, splenius capitis and cervicis. And for these, we have muscles now that are acting on the spine. So all the other muscles were moving the scapula, moving the ribs. Now we're getting onto spinal movers. So for these, we can see that these muscles make a V on the posterior side of the head and the neck. And the first thing you want to note is that spinal muscles, we have to decide whether we're going to talk about a bilateral contraction, where both this side and that side are going to contract at the same time, or talking about a unilateral contraction, where you're only going to have one side or the other contract. If we have a bilateral contraction, so if this muscle is going to pull on the head and the neck, both sides at the same time, then the head and the neck are going to move back this way. We're going to be moving the head and the neck posteriorly, which is going to be extension or hyperextension of the head and the neck. And we're going to see that any of the other spinal muscles, whether we're looking at the erector spinae muscles or the deeper spinal stabilizers that we had talked about, if we have a bilateral contraction of both sides pull at the same time, extension or hyperextension of whatever part of the spine we're looking at. That would be bilateral movement. Unilateral movement would be if we only had the left side or only had the left or the right side contract. It would give us a different set of movements. So with a unilateral movement, if we only have one side pull, the two things we can get are lateral flexion of the spine, which is going to be a tilting of the spine one way or the other, and also lateral rotation, which would be a turning of the spine. So lateral flexion always goes towards the side that's contracting. So if I contract over here on the left, then the head and the neck is going to tilt to the left. If I contract over here on the right, then the head and the neck tilt to the right. So that will be lateral flexion to the same side of the body, the side that's contracting. Left side contracts, I go to the left, right side contracts, I go to the right. It's the same side lateral flexion. All of your spinal muscles are going to cause same side lateral flexion. Not only these, but all the other ones we do on the way down. The thing that they may be different on here is going to be lateral rotation. So if we take splenius, capitis, and cervicis on this side, and they're going to pull this way. Again, we need to break that into its two component parts. The one part would be the lateral flexion, which would be the vertical component. The other portion would be the lateral rotation, which would be the horizontal component. So this muscle, if I grab the ear here and I pulled on the ear, the head's going to turn towards me this way. That is a same side lateral flexion, where the head is going to turn towards the side of the muscle that's contracting here. All right, so splenius, capitis, and cervicis, when they pull this way, same side rotation. If I did it on this side, now I'm over here on the left, now the face and the neck are going to turn to the left instead, pulling that way. The next muscles, looking at the erector spinae muscles again, we can see that, again, we had spinalis, longissimus, iliocostalis, that let's ignore spinalis for a second and just look at longissimus and iliocostalis. And we see that they're oriented slightly in this direction, which is the same direction that splenius, capitis, and cervicis were oriented. So we'd expect them to be synergistic with their movements, and they are. So longissimus, iliocostalis, if we get a unilateral contraction, we're going to, on this side contracts, spine's going to bend to that side, and again, that horizontal part, if I pull this way, the spine is also going to rotate to that side as well. Spinalis, though, that one is an exception because spinalis is straight up and down along either side of the spine. So the line of action for spinalis being this way as opposed to the other ones that are this way. Spinalis has no horizontal component, only a vertical component. So if we get a unilateral contraction on this side or that side, only lateral flexion. So spinalis contracts here, spine bends this way, spinalis contracts there, spine bends that way, but no rotation from that one. Looking at the deeper muscles, if we take these and we move them out of the way, we get back down to, in this area, we could see semispinalis, we can see multifidus. We see that those muscles are oriented this way now. And on this side, it would be this way. That is exactly the opposite of the way that longissimus and iliocostalis are oriented. So the deeper ones are going that way. So what we're going to see here is with that change in orientation, the one movement that's going to change would be the rotation. So if semispinalis, say this muscle here contracts, and I'm pulling like this, part of it is still acting vertically. That is going to be your lateral flexion, but the other part is acting horizontally in this direction here. So if I grab the spine and I pull the spine like this, body's going to turn and face me. All right, that would be an opposite side rotation. If I was on this side and it's pulling this way, the horizontal component would be grabbing the spines and pulling the spine towards me this way, which is going to cause the body, as I pull like this, the body's going to rotate that way, and the face would go away from me. That's an opposite side rotation, and that would stand for all of those spinal stabilizers that we see down there. So in the last muscle we'll look at, let's take the serratus posterior superior, put it back. Let's take rhomboids, put them back. And we had identified this one before and mentioned its movement briefly, but here we can see it again. And that other muscle we identified here, which would be serratus anterior, that one, you can very clearly see the line of action for this muscle is going to pull the scapula in this direction, where rhomboids are going to pull the scapula in that direction. We can see that those are going to want to work against each other, so they'd be antagonistic there, where rhomboids doing retraction with serratus anterior pulling in this direction would do protraction instead.